Diabetic foot ulcer, open sore or wound that occurs in approximately 15% of patients with diabetes, and is commonly located on the bottom of the foot. Symptoms: any changes to the skin or toenails, including cuts, blisters, calluses or sores, discharge of fluid or pus, foul smell, pain, redness, skin discoloration, swelling. Causes due to a combination of factors, such as lack of feeling in the foot, poor circulation, foot deformities, irritation, such as friction or pressure, and trauma, as well as duration of diabetes. Treatment: prevention of infection, taking the pressure off the area, called offloading, removing dead skin and tissue, called debridement, applying medication or dressings to the ulcer, managing blood glucose and other health problems. CAAF risk factors: diabetic neuropathy, structural foot deformity and peripheral arterial occlusive disease.